We interviewed nearly 200 people. We saw mothers with young children and their partners, single mothers with young children, and then we interviewed this very vulnerable group of boys, 26 boys who were unaccompanied minors, who were between the ages of 14 and 17. There were respiratory viruses going around, gastroenteritis going around. It does seem to me that we're sort of starting on the back foot at trying to deliver health services. We're in a remote place, in an extreme climate. We have people living in close proximity, and we can't possibly provide the level of medical services that they need there. So we're dealing with children who've come from a situation of trauma. So some children told us they'd witnessed their father being shot. They'd witnessed or been abducted themselves. They'd had witnessed or experienced physical abuse, domestic violence, political persecution. Then they had a journey on a boat. Many of them told us that when they were picked up by the Australian officials, they were told they couldn't bring any of their possessions with them. So, for example, one woman who wore glasses said, "I can't even see my child." 6 months down the track, she had not had her glasses replaced. They had to leave their shoes on board. And we heard this morning in evidence from the doctors who worked on the island that they had to leave all their medications. And in fact, they were often just discarded when they arrived at Christmas Island. Here we have this group of children who are very distressed, and that's manifest in different ways. So certainly some of them have attempted to self-harm by, for example, cutting themselves, refusing to eat and staying in their room, banging their heads. But much more commonly, children are having flashbacks of the trauma they experienced at home or on the journey to Australia. Children are having nightmares about their current situation. They're bedwetting. Some of them have started stuttering. Some have lost their speech. Some haven't developed speech. And so those sorts of behaviour are very worrying, let alone the fact that none of these kids are getting sleep and none of them are getting education. Then when you've got children witnessing their mothers trying to self-harm or kill themselves, is very distressing. Children hearing the protests and the shouting and screaming. Children seeing a woman jump off the top of a container and cut her neck and bleed profusely. It's very, very distressing. And we're still shocked by what we heard and what we saw on Christmas Island. There's really nothing like seeing for yourself what the conditions are really like.